Well, I think this is an excellent report, and it does two really big and important things. The first one, it makes the point that we need to understand ill health in terms of people's gender. So we do need to understand how women are affected more in some cases than men, and less in some cases than men, so that we're better able to target interventions. The second important thing it does is, of course, to say that women's health is much more than reproductive and sexual health, and that in particular it draws attention to the growing burden of non-communicable diseases and how they are affecting women, and how in some cases they're affecting women more than they're affecting men. So these are great messages, really important things, so delighted to see this report.
We at C3 Collaborating for Health are delighted to see this report. We've been working for some years now on prevention of NCDs, and it's really great to see the focus on women and prevention, because of course the issues can be quite different if we single out women. We're particularly interested in women because of the impact that they have on their families and communities. Very often it's the woman who makes the decision about the food, it's the woman who sets the agenda within the home. So that's one aspect that we're very interested in. Another aspect of our work at C3 is that we work with healthcare professionals, and we have quite a number of activities going on with nurses, both in the UK and globally. And of course nurses are generally women, so they too have, will be interested to see how this report can impact on the work we do with nurses.
This is a really important report. I think there has been for so long just a neglect of women and the gender differences across the world. We see this, and I've done quite a lot of work in low-income countries, and the contrast is extreme. There has been some focus around maternity and that part of women's health, but actually the woman, very often in many of the cultures, is leading the family, is bringing the children up in the way they behave and the way they live their lives and the health issues they suffer, and also looking after the older members of the family. So it's really important that we recognise the importance of understanding the issues that affect women's health, because they will drive the whole of the nation's health in the long term.